Weight loss can avoid 7 severe medical conditions.
Obesity is a term that means you have a body mass index of 30 or higher. It makes you more likely to have severe medical conditions. John is overweight. He tried to lose weight but failed. He's worried about his health.
I am too fat and must be sick. I need to see a doctor.
Today, he is in the hospital to do a full body health checkup. After the checkup, Nurse Lisa is discussing with Dr. Peter.
Dr. Peter, the results showed that John's body mass index is much higher than 30. He's worried about his health in the future. What influences would he have if he couldn't successfully lose weight?
To be clear, not everyone who is obese will have severe medical problems. However, the risk will be significantly raised if one has a family history of one of those conditions, such as heart disease, high blood pressure, diabetes, cancer, osteoarthritis, etc. Here's a closer look at 7 conditions that are linked to being obese or overweight. Extra weight makes you more likely to have high blood pressure and high cholesterol. Both of those conditions make heart disease or stroke more likely. A recent study found that adults between ages 40 and 59 who are overweight or obese have a significantly increased risk, ranging from 21 to 85% higher, of developing cardiovascular disease. The link between heart disease and obesity is multifaceted. Direct effects are mediated by obesity-induced structural and functional adaptations of the cardiovascular system to accommodate excess body weight. Indirect effects are mediated by coexisting heart disease risk factors such as insulin resistance, hyperglycemia, hypertension and dyslipidemia. Overall, obesity increases one's risk of developing many other risk factors for heart disease. The good news is that losing a small amount of weight can reduce your chances of developing heart disease or a stroke. Losing even more weight has been shown to lower the risk even more. The second disease linked with obesity is diabetes. Most people who have type 2 diabetes are overweight. You can cut your risk of developing type 2 diabetes by losing weight, eating a balanced diet, getting adequate sleep, and exercising more. If you have type 2 diabetes, losing weight and becoming more physically active can help control your blood sugar levels. Becoming more active may also reduce your need for diabetes medication. The third disease is a group of cancers that are linked with obesity. Obesity has a major impact on cancer. Obesity is now overtaking tobacco as the leading preventable cause of cancer. Several studies have shown high rates of obesity in cancer patients at the point of diagnosis. The mechanisms by which obesity may increase the risk of cancer are not well understood. It is believed that the combined effects of the adipose tissue environment and the endocrine alterations of obese people both interact to promote tumor initiation and progression. It is reported that cancers of the bowel, breast, womb, kidney, and esophagus, gallbladder, ovaries, and pancreas etc. are closely linked to obesity.
That's horrible.
The fourth disease is osteoarthritis. Osteoarthritis is a common joint condition that most often affects the knee, hip, or back. Obesity is widely acknowledged as a risk factor for both the incidence and progression of osteoarthritis. Carrying extra pounds places extra pressure on these joints and wears away the cartilage that normally protects them. Researchers have found that obese individuals have significantly more severe joint degeneration in the knees compared with normal weight or underweight individuals. Weight loss, coupled with exercise, is recognized as a cornerstone in the management of obese patients with osteoarthritis and can lead to significant improvement in symptoms, pain relief, physical function and health-related quality of life. The fifth disease is gout. Gout affects the joints. It happens when you have too much uric acid in your blood. There's a very tight association between overweight and the risk of developing gout and gout flares. Improving diet, including avoiding sugary soda, exercising and keeping your weight closer to a healthy number, can help lower uric acid.
Thank you, doctor.
The sixth disease is sleep apnea. That's linked to being overweight. Sleep apnea can cause a person to snore heavily and to briefly stop breathing during sleep. Sleep apnea may cause heart disease and stroke more likely. Weight loss often improves sleep apnea. The last disease linked with obesity is gallbladder disease, especially gallstones. Obesity can lead to gallstones because it alters the balance of substances in the gallbladder. Excess body weight also makes the gallbladder difficult to empty, and this allows cholesterol-rich bile to accumulate and harden into stones. Losing excess weight is a surefire way to reduce your risk of gallstones. Conclusion: weight loss can avoid many diseases. We hope you like this video and don't forget to click like and subscribe to my channel for more health-related videos.